Hey, from Florida's Gulf Coast, where the sun-kissed waves inspire us. Thanks for joining us again today for this episode of Talent Talk and Strategy Stroll, where we try to navigate the intersection between talent optimization and business strategy with some wit, a little wisdom, and a dash of sibling rivalry. I'm your co-host, Tim Stockwell, joined by my ever-able sister, Mare, a passionate schnoodle mama, a woman sports fans, business and talent strategist, a true mental fitness coach, a trusted advisor, and a board chair, Mary Stock. Mary, how are you this morning?
I'm doing great. It's a beautiful day here, and really excited to pick up our conversation with David today. So, yeah, it's been a great day. How about yours?
Yep, perfect day. Getting ready to head out of town.
All righty. Well, welcome back to Talent Talk and Strategy Stroll. We're excited to continue our conversation with you, Dr. Duffy, who is the Vice President of Women's and Children's Services at OSF Healthcare. In our previous episode, Dr. Duffy shared his insights on the challenges and resilience of women and children's healthcare in a post-pandemic Midwest. Today, we're going to delve a little bit deeper into the strategies he's employing to navigate the new normal in healthcare. So join us as Dr. Duffy, a passionate advocate for his patients, sheds lights on the critical role of talent management, strategic innovation, and advocacy in shaping the future of women and children's health services. We'll also discuss the lessons learned from the pandemic and Dr. Duffy's vision for a brighter future for healthcare. All righty. That was a mouthful.
You covered it well, Mary. Good job.
All right, let's dig in.
Yeah, let's get started because I think where we left off in our previous episode with Dr. Duffy was talking about talent and talented optimization. So, Dr. Duffy, as you're looking around and you're really in the midst of this, what are some of the most critical talent needs you see right now to be able to address the women and children's services that you're dealing with?
Yeah, so I just as we talked about the last time, really, with needs for all levels of our organization in staffing both nurses, staffing for physician assistants, NPs, physicians, but then also our front desks and the folks who are in supportive roles as well. And so, the world is changed a little bit, in the past 5 years. We need folks who can be sensitive to diversity, equity, and inclusion. Really need folks who are interested in working in environments where we serve a very diverse population and accepting folks there. Really a willingness to be a bit flexible and have some cross training in some of the areas and some of the roles that are there, and dedicated to increasing access and making what we can offer as a healthcare system very personalized to folks as they're trying to seek our services. And so, we need them to be well trained, and we need them to be balanced, and we need folks who can operate in challenging settings.
I can imagine, especially with the specialized services with women and children, how critical that is to have not just the technical capabilities, right? You got to have that, but then you have to have, I think, what everybody kind of affectionately calls the bedside manner.
Yes.
To create that relationship role and allow people to help trust you, right? Is that a big deal? I mean, is that an issue?
Yeah, I really think that's right, Tim. I mean, the idea that we can just perform a service without making it an exceptional service and one that patients enjoy and feel empowered in is really necessary. And that takes intention, that takes training, and that takes dedication to those softer skills.
Yeah, absolutely. And as you said, I think we talked about earlier in the other segment was, those are going to becoming the needs and the requirements going forward. Creating that relationship capability, not just with the patient, but with the entire medical team that's
Yeah.
going to be involved in everything. So yeah, you certainly have your work cut out for you.
Without a doubt.
Yeah. So, are there some unique skills or qualities that you are looking for as you're looking at growing leaders from within your organization that can
Yes.
take on different or bigger roles in the future?
Yeah, leadership development is something that we're really engaged in, and have created opportunities for leadership development, from resources inside as well as some outside resources that we bring in. I think what we're finding is that, it's not enough to manage, right? Or direct, right? We really need to lead in this time. And so, um, people have to be respectful. They have to be humble. We're interested in service-oriented leaders that are compassionate and passionate about the work that we do. And sometimes, as you lead in this space, the difficulty of healthcare is a very regulated industry, and it's a very difficult, challenging industry at times. And so, it's always much easier, sometimes at the bedside, because you have a prescribed bit of what's needed or in a particular situation. But leaders need to be a little more adept and a little more flexible than what they've been before. And so, those are some of the things that we're talking about. We went through this phase where we talked a lot about efficiency, but we have to really focus on effectiveness as well, and making sure that we balance that, right? And have a balanced approach to how we do that. So, yeah, we're taking physician leaders. We're taking operational leaders. We're taking nursing leaders through different types of programs to help develop and make them successful in their spaces.
That's fantastic because you're going to need it. You're going to have to obviously grow from within. It's going to be a lot easier than trying to constantly be out there recruiting for those kinds of roles. So the leadership training is incredibly important.
Yes. Yeah.
Are you doing anything like in the high schools where you're starting to do any type of like internship type programs, or starting people, or even offering little scholarships from high school and to get people to get into college and then come back and work with you?
Right. So we are engaged in programs in the high schools, even down into the middle schools. We do some things like hands-only CPR training, right? And we do some things like having Fitness America or Girls on the Run, or, there are a lot of different types of things that we do, and then some very locally specific types of things, getting the healthcare industry there. But we've also started going in and actually doing focused education on things like vaping. And we've worked with a STEAM program that really is around how do we innovate and work with kids, in focused areas. And we've focused that around some of the medical technology or those types of things in those settings. And so we really are trying to encourage that and create those relationships early on. We have relationships, certainly at the collegiate level as well. But everybody's focusing deeper in, right? Because it's sonographers, it's X-ray techs, it's everything that we really need that help in.
And you have such a rural population. If you're having and educating the middle schoolers and the high schoolers, and then maybe someday they're going to join your organization because they're already kind of entrenched and understand what's going on. If you're providing a little bit of, training in advance and those types of things, getting them understanding about what's possible.
Yeah, absolutely. In my mind, that's the key to creating kind of that pipeline, right? I mean, you never know when you're going to spark the interest of somebody who didn't
Yeah.
think they were going to do something different. And gosh, what a great opportunity for the community and for us as an organization in securing work talent.
Yeah, yeah. So we're going to shift now a little bit to strategic priorities for the future that you see,
Yeah.
particularly in your healthcare. Um, some top priorities, some strategic priorities for women and children in the next few years. What do you see as really the top three real priorities?
Yeah. So I think one of it is making sure that we have access to care, right? So I think in the last segment we were talking a little bit about how in for pregnant patients we lost some of the access that we had with closing of some birthing units. We've lost access to some of that postpartum care. We're finding that sometimes the specialized children's needs are difficult in maintaining access in the central Illinois area. So it's how do we provide that care close to home, and how do we make it available? Folks who have travel challenges and financial challenges to begin with. I mean, it's got to be something that works for them while we address that. So when we look at access, we're employing some technologies to bring that care to where people are at. That can be through educational programs that we have out in the different communities. It's virtually. So we have virtual urgent cares now for the simple earache or sore throat or things like that. And how we expand on these types of things becomes an opportunity for us to create stickiness, brand awareness, and loyalty. So we need to do a good job, and we need to be available in those different types of avenues. And so I think it's great. I think it's also something about being a bit more holistic in our approaches to some of the care that we've traditionally delivered. It's not just the acute care pieces of it, but we're finding the chronic care. I've always felt that the U.S. healthcare system does pretty well with the acute stuff. I mean, when it really hits the fan, you want to be in an ED, or you want to be in a well-prepared place, right? But on the chronic side, we've not done as well at helping folks navigate and support in different ways. And so I think that is a lot of what we're looking at in the children's area, as well as the women's area.
Yeah, that's just so critical. And really, our last episode we talked about COVID a bit. So if you could take a gift from COVID, it may be the gift of this type of care, where it's now it can be telehealth. You can have an inclusive system without really leaving your home, where before that was for the wealthy.
Yes. Yeah.
Right. Now it's widely available and widely accepted.
Yeah.
Because it had to be, but I mean, now it's super convenient.
Yeah. It really is. And I think that's a great opportunity for us in the future. And I think that, what we learned in the pandemic is that we can be fast, right? We don't have to be quite as slow as what we were. Incredibly nimble at like just putting the platforms for telehealth up and then making it available for every single caregiver to be able to engage patients virtually. Really very important. Some of the things that we're doing in our on-call spaces, mobile vans, and then the virtual visits, and connecting that back with the primary healthcare team of the individuals. Really, it is the silver lining, right, to the black cloud of the pandemic, that we can be more innovative and faster. Yeah.
So are you excited about any emerging trends or models of care that you're really excited about?
Yeah, I'm excited about the virtual interactiveness. I'm excited that the care isn't just um it doesn't have to just be in your own geographic location anymore, right? So that we can understand what's happening. I'm really excited about the personalized care that we're going to be able to deliver as time goes on. We've seen some great advances. You know, during the pandemic, it was very interesting when we were talking with researchers at the University of Illinois, right? And everybody was trying to figure out how can you make a ventilator? How can what's the molecular biology of this? How can you get to testing that would be accurate? That was the first part, making it available in different ways other than sticking a swab all the way back into your cranium. But were there other opportunities to diagnose in different ways? So the thing that did was take a lot of our personalized genomic and molecular types of research and put them into a practical setting. We accelerated how quickly we could do trials. Big data and analytics is helping us be able to assimilate information in ways that we've never been able to do before, and how we apply that forward. And so I just think that over the next 5 to 10 years, we're just going to see tremendous advances in the types of illnesses that we can treat, in sometimes things that have had a kind of a lethal diagnosis, maybe not so much anymore if we can afford to give that. So, yeah, I think it's great.
That'd be
As
amazing.
you had mentioned though a little bit about, you talked a little bit about technology and innovation and that sort of thing, Dr. Duffy. How do you see AI influencing some of the practices you might be going into to either speed services or helping patients understand things a little differently? Is there AI technology now in the healthcare industry?
Oh, there is. It's one of the early adapters to some of the AI technology. Just the mathematical models that you can use and the projections that you can make with that is incredible. One of the things that I actually do in my role is help create clinical standards. And so, when I came out of med school back in 1994, they used to say that I had to read 10 articles a day to keep up in the medical literature. Well, that's only it's way advanced, right? And so even in setting those clinical standards and thinking about what we need to do, capturing that information and using AI to help me capture that information and assimilate it into creating standards, and then testing that out. And so we don't, we're not at a point where we rely on it or take it as gospel truth. There's always a panel of physicians and things that look at this and make sure that it makes sense. But our ability to do it quicker is really advancing. And so I think getting to diagnosis, right? That's always been challenging sometimes, the chronic thing, and you don't really have a diagnosis and that type of thing. All of a sudden, you have access with this data and with AI to start delving and pulling the strings of little symptoms or other things together in a way that I think will be incredibly valuable.
Yeah, that's exciting to understand that nature of that, where you're trying to piecemeal all these different symptoms.
Yeah.
It's kind of like a mechanic when you take your car in and it goes, the sound goes clunk, clunk, clink, clunk, clunk, clink. What's the problem, right? My car. Same kind of thing, right? I go in, I just have, it's a pain here and it's an ache over here and it's this. But as you start putting all that together through AI,
right,
it should help. I can see that. And I can see it just as a lay person looking at that.
Oh, yeah. I mean,
Yeah.
So what kind of opportunities then, taking all that in consideration for positive change, do you see emerging through this challenging time that we've gone through? You've mentioned a few of them.
yes.
Where do you see the most positive change occurring and the direction perhaps that it's leading?
Yeah. So, certainly we're going to advance in our ability to treat and diagnose and change the course of some of the natural history of or natural course of a disease process. And so that's fabulous. I mean, we're seeing that happen a lot. One of the things that I think is really positive is looking at the drivers of health, the social drivers of health, and what the influence of environment and impact, nutrition, transportation, education, some of those things that we haven't really thought about as affecting healthcare. But when you start to look at where those impact the cost of spend and how we deliver care and the needs of folks as time goes on, I think I'm as excited about some of that as the other technical advances that we're going to make, right? And so if we can get healthcare to folks who really need it, when you compare us to the United States to some of the other countries in maternal morbidity and mortality, gosh, we're not so great compared to many of the other higher income nations. And so they've figured out something around access and provision of care that we have still some learning to do. And it's a much about how we deliver that and make it available to folks as we can. And so, those are the types of things. If we can impact nutrition, and if we can impact maternal morbidity and mortality, and if we can impact the infectious illnesses on kids in a way that we've done in the past, but it's those broader stroke types of things that not very sexy to talk about, but probably much larger impact societally, and with the healthcare dollar spent long term, right?
Yeah.
That'll have an impact. So I'm excited about that.
Yeah, I like the whole holistic perspective, as you have a chance now to step back and look at it, just even if you were to look at the food quality, which is ours, comparing some of our food quality to some of the other nations of the world. Ours are a little different.
Yeah. Yeah.
So, there's a lot of things that could be challenging there, but yeah, I think that's there's going to be a lot of change, and I think through a combination of the technology, the AI, a more holistic approach, a healthier approach to people, I think is going to be fantastic. So I think that leads right into, the role of advocacy that you have, don't you think, Mary?
100%. I was just thinking that when you were talking through that, and some of it may even actually repeat, but how do you yourself and maybe your department advocate for the needs of women and children within your organization and the broader healthcare system as a whole?
Yeah, it is really around trying to advocate for positive changes in those areas. So it's really about connecting with community, and it's about advocating at a governmental level at times around some of those policies that are important. Things like immunizations. So immunizations for kids that we've got. I listened to my dad talk about when the polio vaccine came out, right, and the fear that parents had late summer going to the fairs and those types of things, a real disease. And then, kind of the acceptance of a lot of immunizations. And then we've had this anti-vax kind of movement creeping up, even prior to a lot of folks with serious concerns around that, links to other types of things. But we have seen a real decline in the immunization rates of kids. And so now we're starting to see these measles outbreaks, right? So measles has become a real deal again. And I used to say that my mom could diagnose measles better than I could because I haven't seen very many cases, right? So
Yeah.
the pattern of the rash and those, but and adequate nutrition, right? When you start looking at kids who are homeless or unattended, and you look at the ability for them to get the types of foods that you were mentioning, Tim, around what's the quality of food? Well, I got $15 and that's barely enough to get a McDonald's meal anymore, right?
Right, and peanut butter and jelly.
Yeah. So those are the things that we start to look at, and so we do partner with the community in a variety of ways. We are asking specific questions around what the drivers of health are, so we can understand the impacts of that. We even have a program in our children's hospital now, whereas we're asking those questions on the inpatient setting as well. We're connecting them to resources, and we can even send them home with a bag of groceries, right? We've got a package that would get them a couple 3 days of adequate nutrition for family, and then connect them with some other types of resources that are out there. But food is medicine, and we're finding that addressing some of those really can make a difference, both cognitively and developmentally, and significant from a health-wise perspective for kids long term. And that's a hard ROI to calculate, right?
In today's thinking, yes, but I presume that as you guys move through this a little bit deeper, you'll be able to create those links to say,
yes,
here's where the return is, because our patients are healthy. They're not coming in this frequently. I mean, but I think you got to start, and I think that holistic advocacy approach makes a lot of sense. Again, a lot of rural communities are working,
right,
and the bigger cities too.
If you could put on your wizard hat like Harry Potter, one of my favorite book series, what policies would you change or like to see implemented to improve care for this population? So you're putting on your hat, you're snapping your finger, and what changes?
right. Well, I would, I would, and I'm not a politician, so but I guess the things that I would like to do, when you start looking at kids, right, the top 3 causes of mortality in the United States are around suicide, violence, and then guns. So somehow addressing those without becoming it's so polarized in those conversations, one about access to those things, to guns, access to appropriate behavioral health, and mental illness types of services that are out there, really important. When we talk about healthcare coverage for kids and moms, okay, so just at those areas, we really shouldn't have parents trying to decide what they're gonna give a kid from a food choice versus a medication, and both of them conflicting, right? So if I could be a wizard, and this is my pediatrician background coming out, I would make sure that there is adequate healthcare coverage and adequate childcare coverage for kids, and ensuring that there are safe environments for our kids to be educated in. And I think, I think maybe in the last episode, I talked about the billions, hundreds of billions of dollars, $122 billion in lost wages, productivity, really around the healthcare, or not the care, the child care situation, and folks who had to quit during the pandemic to be able to provide that care. And so some way helping us do that, and then making sure that, when babies are first born, we have adequate leave for parents, both men and women, to help with some of those. Kind of interesting that some of those countries that do better in the maternal morbidity and mortality rates also have longer times off for new parents. And being able to engage and create, that stable first year of life.
Well, I love your wizardry hat, and I'm going to manifest that alongside of you. I think it's the perfect way to wrap up today. I think that's really powerful and a great vision. So thank you again, Dr. Duffy, for joining us.
Thank you.
Once more on Talent Talk and Strategy Stroll. Your passion for women and children's health is truly inspiring. Your insights on navigating the challenges and opportunities in the field are invaluable to our listeners. We appreciate you taking the time to share your wisdom and expertise with us.
And truly, your wisdomry.
Wizardry.
Wizardry.
Yeah.
Yeah. Somewhere there's the right word, but
Play on words.
it's the magic wand of Dr.
Magic
David.
wand.
Yeah.
I like it.
That's great. Well, it was a good discussion. Both sessions were great discussions, and we certainly do appreciate it, Dr. Duffy. So for those of you listening, we try to help you with some of your tough people issues and challenges, and we want to help you create the strategic business growth that you're looking for. So tap into our expertise anytime. We do leadership development, mental fitness coaching, and we can do that anytime and anywhere. So we look forward to hearing from you, as most of you, many of you do, and we appreciate it. So why don't you take a look at our Talent Talk and Strategy Stroll podcast on Spotify or wherever you get to listen to those, and let us help you transform your talent and achieve lasting results. And you can reach me at any time, 816-522-4777, or Mayor at 727-260-2085. Or we're on LinkedIn individually and as an organization. So again, until next time, this is Tim Stockwell with my sister Mary Stockwell and our fantastic guest, Dr. David Duffy. Thank you very much. Mayor, I will see you on the beach, and Dr. Duffy, probably along the water's edge at Clifford Lake sometime.
There we go.
On the party porch.
And the party porch, right?
Yeah, you take care, and thank you so much. That's a wrap. Great job.